Constipation is a pain in the butt, pun very much intended. I'm Dr. Mona Amin, a board-certified pediatrician and mom, and we're discussing what constipation is, why it happens, the causes of constipation, symptoms, and how to prevent it. A second part of this series will include medications and other management of symptoms. Let's get to it. Constipation is often thought of as a child who isn't pooping, but the symptoms can also occur in a child who is passing stool. Various definitions include pain and discomfort when passing stool that may include excessive straining, small, hard, and pebble-like stool, and infrequent bowel movements. The North American Society of Pediatric Gastroenterology, Hepatology, and Nutrition defines constipation as having symptoms for 4 weeks or more and recommends using the Rome 4 criteria for children over 4 years of age. Symptoms may include irritability, abdominal pain, decreased appetite, and early satiety. For stool appearance, the Bristol stool chart is very useful. Normal stools are types 3 and 4. This is what we want to see, while constipated stools are lumpy or hard lumps. This chart isn't applicable for infants who may have different stool patterns. Breastfed infants can go several days without a bowel movement, while formula-fed infants should go every day or every 2 days. Look for signs like abdominal bloating, straining, and irritability in infants to also identify constipation. To manage constipation effectively, it's crucial to understand its anatomical and physiological basis. When your child eats, food moves from the mouth to the stomach, then to the small intestines where nutrients are absorbed. Waste then enters the large intestine or colon where water and salts are absorbed, forming stool. Excessive water absorption can make stool hard and dry. The large intestine's contractions, known as peristalsis, help move stool along. If stool remains too long in the colon, it becomes harder as more water is drawn out, making bowel movements more difficult and uncomfortable. This can cause straining and reduce bowel motility. Additionally, hard stools can disrupt the sensory signals in the rectum and anus, making it hard for a child to recognize that they need to go. Persistent constipation can lead to a psychological cycle where the child avoids the bathroom due to pain, worsening the issue. Hard stool leads to pain, leads to avoiding stooling, leads to more water loss in the colon for the stool that remains, and the cycle continues. Regular bowel habits and addressing psychological barriers are key to preventing and managing constipation. This is why you may find yourself becoming a constipation doula, coaching your child through bowel movements. This is important to remove that psychological block that may make them not want to use the toilet or poop. And so it's imperative we create regularity for your child's baseline stool habits so this doesn't happen. We will explore strategies to establish regular stool habits and prevent constipation from occurring. The most common symptoms of constipation in children are having a bowel movement 2 or fewer times a week, small stools, pain with bowel movements, and/or abdominal pain. Constipation can also lead to anal fissures because large, rocky, hard poops can cause injury to the skin around the rectum and anus when the child has a stool. A child can also have fecal streaking. Sometimes children have already developed constipation and are becoming backed up, but have not yet reached the point of something called Encopresis. When this happens, sometimes passing gas, farting, or flatulence can lead to small streaks or chunks of poop smearing in the underwear, known as fecal streaking. Encopresis, or when your child resists having bowel movements, causing impacted stool to collect in their rectum, forcing stool to leak out around this impacted stool, is a severe form of constipation. Encopresis is the most confusing symptom of constipation for some parents because it tends to look like diarrhea, when in reality it is from significant constipation. There's a large blockage, and newer stool is trying to make its way, in a liquefied form, around the blockage. If you want a video dedicated to only Encopresis, comment below. Many of these symptoms are difficult for parents to know about, especially in children who are potty trained and aren't always forthcoming about when they stooled or not. This lack of knowledge can further the constipation issue, as many children don't understand the significance of things like irregularity of bowel movements and how this can lead to further symptoms down the road. It is important to maintain an open conversation with your children regarding their toileting habits. Knowing how often your child is defecating can save your children from having more pain down the road, as you can then help to intervene early. Now let's discuss ways to prevent constipation before it happens. Step 1, know your child's baseline stool habits. This is vital because everybody has different stooling habits that can be considered normal. Some people go 3 times a day, some go every 2 days, and are comfortable and are not constipated. Know your infant's or child's stool habits so you can closely monitor if they begin to get constipated and act early to avoid that vicious cycle of stool remaining in the colon like I discussed. Infants and toddlers should have multiple stools a day, but older kids may have stools every 1 to 3 days, but it's important to check in with your child's baseline. Step 2, know your child's triggers. For example, they don't stool at school because they don't prefer that toilet, certain foods make them constipated, stress makes them constipated, or transition periods. Knowing their triggers can keep you ahead to provide more natural relief and monitoring during these trigger moments. Step 3, improve dietary habits and hydration. Some kids may be more prone to constipation because of limited diets and lack of hydration. But to take a natural, non-medicated approach, it's important to consider the foods we eat and hydration status. A diet low in fiber, which is found in fruits, vegetables, and whole grains, can lead to constipation. Diets that are high in processed foods, dairy or meat, can contribute to constipation. If your child fills up on processed foods, dairy, and meat, they may not eat enough high fiber foods, leading to constipation due to lack of fiber and feeling too full. Fiber adds bulk to the stool, making it pass more easily through the intestines. Whole grain foods and legumes and lentils can also help. Here are some fiber-rich foods to introduce to your child's diet from the moment they start solid foods. Every child has a go-to poop food, so this may take some research on finding the best foods for your child's pooping habits. Yogurt and fermented foods, foods that contain live active cultures like yogurt, can promote healthy gut bacteria and aid digestion. My favorite is kefir, or yogurt for younger children or infants with live active cultures. Though there is not significant medical research and evidence to support the use of probiotics and the treatment of constipation, many of my parents feel like they really help their constipated child. The thought behind using probiotics is that they can help regulate bowel movements by improving gut motility, improve stool consistency by making the stool softer, balance gut flora, which may help reduce constipation that may be caused by an imbalance of gut flora, and reducing inflammation. For constipation, strains like Bifidobacterium lactis and Lactobacillus rhamnosus have shown some efficacy in some clinical studies, although deciding to use probiotics is a case-by-case basis you should discuss with your child's clinician. Not drinking enough water can also cause stool to become hard and difficult to pass. Remember, the colon draws water out of stool, so if your child isn't consuming water, this will be more prominent. Encourage your child to drink water throughout the day. Limit sugary drinks and excessive fruit juices, and incorporate foods with high water content like cucumbers, watermelon, or other melons. For infants, continue breast milk and or formula and water with meals when you start solids and they're older than 6 months of age. Of note, starting solids in infants is a common dietary factor that can lead to constipation. Formula and breast milk are easily digested, and the introduction of solid foods slows digestion and can lead to constipation, as your infant's digestive system is still learning how to process these complex foods. Most first foods are also low in fiber and high in iron, both of which can make stool harder to pass. When your baby is on solids, they are also less likely to be taking the baseline number of liquids that they were taking, so it can make the stools harder and therefore more difficult to pass. Incorporate fiber-rich foods, which can help bypass this issue, and also start with one meal and advance as tolerated, looking at their stool habits. Step 4, promote physical activity. From the moment your child starts tummy time, encourage motor development in general because this helps passing stool as well. Physical activity stimulates that muscle motility of peristalsis in the colon, improves digestion, and reduces bloating. Step 5, establish healthy routines. This is especially important for a potty-trained child, and if you need more guidance on potty training, I have an entire course for you available on my website and via a link below. Some potty-trained children may be too busy playing or they don't want to miss out on playtime, so they ignore the urge to use the bathroom, which leads to that cycle of hard stool. Some children between ages 2 and 5 may want to show their autonomy by holding back stool as their way of being in control. Yes, this is real, and that is why power struggles in potty training can be so problematic. And other children may not want to stool at camp or school because they don't like public restrooms. Encourage bathroom visits at regular times, such as after meals, to take advantage of natural bowel reflexes, including that gastrocolic reflex. Don't pressure them to stay on the toilet if they don't need to, but gentle reminders and encouragement help. Positively reinforce when they listen to their body and use the toilet. Allow your child to have access to a step stool to place their feet on, which can help put them in a natural squatting position that can help move bowels. Provide reassurance and discuss any behavior such as avoidance of stooling in certain locations to overcome this fear in a non-shameful way. For infants, sometimes placing them in a swing or bouncer can help them poop because this upright position puts their anatomy in such a way that the poop comes out easier. Some parents call it the pooping chair. Changes in routine can also disrupt your child's digestive system, which can lead to constipation. These changes may be traveling, altering sleep patterns, or going back to school. Though these things are not preventable, it is important to promote other good habits during these times of change to prevent constipation. Part 2 of my constipation series will discuss some other options to consider if you find that your child is constipated with these changes in routine. Step 6, become a constipation doula. What? Dr. Mona, what are you talking about? This is my coined phrase to describe the emotional and psychological coaching you may need to do to support your child who is constipated to break through that mental barrier that can cause them to not want to go. The hard stool can sometimes cause pain to your child when they do eventually defecate, making them not have a complete bowel movement. The stool then stays in their intestine, becoming harder, causing more pain with defecation, and the cycle continues. We have to be there to reassure them and occasionally soften the poop as well. Acknowledge and validate your child's discomfort. Let them know it's okay to feel this way and that you are there to help. Coach them through painful moments by holding their hand and asking them to relax their body and verbally cheering them on. Celebrate and reinforce when they pass the stool. Here's an example of me showing what it feels like to be a constipation doula in a video I posted to my socials.
Listen, look at me. Look at me. You can do this, okay? You gotta push. I know you can do it. And yes, I know it hurts. Relax your muscles, take deep breaths, and breathe. Your body knows what to do. Just trust it. You're so close. I can see it. Trust it. Listen to your body, and when you feel the contractions, push. Yep, take my hand. It's coming. You did it. I'm so proud of you. It's beautiful. You want to see it?
Offer reassurance and support. Use warm baths or gentle abdominal massage to alleviate discomfort. If your child won't stool, don't force them down onto a toilet. Say, I know you can do it and we can try again later. Ensure that bathroom times are stress-free. Avoid pressure or punishment related to bowel movements. Allow your child to take their time defecating so that they don't feel rushed or stressed. Like I mentioned, it may be helpful to have a small stool in your bathroom for your child to rest their legs on in order for their pelvic floor to be in an optimal position for having a bowel movement. The more relaxed your child is when having their routine bowel movements, the more likely they are to have a complete bowel movement, which will prevent any issues with constipation in the future. If you notice there is increased anxiety about pooping and tips from my videos don't work, speak to a medical professional. I can't stress enough that there is a psychological component to constipation just as much as a physical one, and it can become a vicious cycle. Our goal in the management section of part 2 of constipation will discuss the very important combination of softening the stool combined with the psychological approach we discussed in this video. Because for many constipated kids, they need to overcome the fear to feel comfortable stooling again, and sometimes the stool needs to be softened more to be able to do that. Not all constipation is functional, and sometimes there can be other underlying medical conditions your doctor may want to evaluate. You should seek medical attention if any of the following are occurring in your child. Persistent or severe symptoms if constipation lasts more than a few weeks despite dietary and lifestyle changes, or if it becomes a recurring issue, or if constipation is causing significant discomfort, pain, or distress. Significant changes in bowel habits if there is a marked decrease in the frequency of bowel movements, fewer than 3 times a week, that does not improve with home interventions, or your child is passing consistent Bristol chart type stool 1 or 2. Associated symptoms like abdominal pain, blood in stools, or vomiting with constipation. Behavioral issues. The constipation is impacting toilet training, or the lack of pooping is impacting their mood and leading to more tantrums. Being constipated is painful and uncomfortable, and it is a real thing that it can lead to more behavioral issues due to the discomfort, so we want to manage it. Signs of fecal impaction. Symptoms of fecal impaction such as persistent abdominal pain, bloating, or the presence of hard impacted stool in the rectum. And for newborns and infants, if there are significant changes in bowel patterns or signs of discomfort, especially if the baby is not having bowel movements as frequently as expected, or if there are concerns about the baby's feeding or growth, or if your newborn or infant has never passed stool from birth, we want to evaluate. On our next video here on our channel, I'm going to be discussing management tips, including some medications available for constipation for children. So make sure to subscribe to this channel to stay connected. How do you prevent constipation in your children? Is there a specific food or strategy that you feel helps keep them regular? Let me know in the comments below and be sure to share this video. I hope I brought more confidence into your parenting journey. Stay informed, stay empowered, and I'll see you all next time. Stay well.